everyone, this is your host Hemalata. Today we are talking about something that really affects one in every five women. That's PCOD. Although it is a common condition, we still have a lot of myth and confusions around it. To help us understand this better, we have Dr. N. Sapna Lulla, who is a very famous gynecologist dealing with PCOD and other hormonal issues for years. Without wasting any time, let's dive into it. Hello, ma'am. Welcome to the episode.
Thank you.
Ma'am, we're so happy that you are here today because most of the women out there, we are facing a lot of health issues like PCOD, PCOS, and whatnot. So I'm sure we are all happy that you will give the best answer and the best solution.
Hopefully, by the end of the session, we are going to have a more better insight to PCOD and PCOS.
Doctor, kindly help us understand what is PCOD.
So, in simple terms, Hemlata, PCOD is otherwise polycystic ovarian disease, where the ovaries get affected, they form immature follicles, and these follicles get retained as air-filled sacs, otherwise known as cysts, leading to hormonal imbalances, causing certain symptoms like irregular periods, weight gain, acne, hirsutism. That's what PCOD is all about.
And doctor, we have a light confusion that PCOD and PCOS, two different things is what we know. What do you say about it, doctor? Is it same or two different things?
Very well said. This is a question which is very often asked in the outpatient offices. PCOD or PCOS? What is it that I have, doctor? So PCOS is a broader spectrum of PCOD. When these air fluid filled sacs get retained in the ovaries, they cause a hormonal imbalance which changes on to a severe endocrine disorder, causing complex changes not restricted just to the ovary, but it spreads to the entire body organs. Like there could be weight gain, there could be acne outbursts, there could be thinning of scalp, there could be hirsutism, unwanted hair in various parts of the body. That is when we call it as polycystic ovarian syndrome.
Okay. So which one you say which is very dangerous? Like, is it PCOD or PCOS? I know both the issues has a lot of issues. So you tell me which is...
It depends on the age group.
Okay.
But definitely PCOS is something which is more detrimental because it affects you in the long run, leading to cardiovascular issues, type 2 diabetes, impacting mental health, affecting your productivity. So definitely the syndrome is what is more detrimental as compared to the disease by itself.
Doctor, we hear a lot of women talking about PCOD. Is that the awareness or is it a lifestyle?
I would say it's a mix of the both.
Okay.
So it's both awareness as well as lifestyle. The general awareness is more, the detection facilities are better. People, rightfully the way we are having this talk today. So more of social media discussion, ultrasound facilities to detect them earlier, and more of detecting it at a very earlier age.
Okay.
A decade ago, if somebody was to say, I have an irregular period, it would just be written off. But as of now, even the clinician would give you a here. There are better ultrasound facilities for it. And there's much more awareness where people reach out much more earlier to the clinician too. So definitely, it's a mix of both a general awareness as well as early detection.
Well, doctor, at what point of age will a girl or a woman try to find this PCOD or a PCOS issues?
Genetic predisposition as such for a PCOD is not a single gene disorder. So it's more of a polygenic feeling. In the sense, it's not a direct relationship. There's no single gene Mendelianly directing it towards some genetic background. But definitely genes related to type 2 disorders of diabetes, genes related to any kind of insulin sensitivity issues, genes related to luteinizing hormone, follicle stimulating hormone receptors, or a steroid hormone production itself can predispose and increase the risk factor towards the predisposition of polycystic ovarian disease.
Okay.
Now, coming to the age, I would say it could be as early as 12 years to as late as even 35 to 38 years. So it's both the extremes of the age is when we detect this in our OPDs.
And what is that age that you usually see, doctor? Like, as you said, it is 12 years, it starts. And with the patient that you see every day.
Many of the mothers walk in with anxious daughters between the age group of 16 to 19 years.
Oh, that's too early.
The teenagers are quite worried. The acne outbursts on their face is something which really walks them into our offices every other day.
Doctor, can stress or lack of sleep can make this PCOD more worst?
Definitely.
Oh.
It's both bidirectional. So disorders in sleep where the quality of sleep is affected or the duration of sleep is affected, or sleep issues like obstructive sleep apnea syndrome can worsen PCOD. Indirectly, polycystic ovarian disease symptoms can cause sleep disorders in a patient itself. So women suffering with stress can have sleep disorders, and the cycle of events continues where it can worsen these cysts in the ovaries.
Okay.
So it's all interrelated basically.
And doctor, most of us we think PCOD comes with overweight. You know, when you're overweight, PCOD is there, PCOS is there. So how true is that, doctor?
When you're overweight, you have a sedentary lifestyle. You have a sedentary lifestyle, then you're stressed about the fact that you have an accumulation of fat in all places, which is unwanted, especially the lower abdominal regions. Then you stand in front of the mirror and you're not able to get into the clothes which you would have bought over the weekend. That again gets you stressed out. You have sleepless nights over it, and that's how the cycle again continues. So it's both together. At the same point of time, as I just spoke about the fact saying that we have a gene predisposition which could be interrelated to insulin sensitivity. So when the insulin levels are high, we have high androgen levels. The glucose transport gets affected. There's accumulation of fat. Breakdown of fat is affected. Indirectly, that makes you more obese. So as I said, it's both interrelated to each other.
Okay, we didn't know this actually.
But yet, there is something called as a lean PCOD also. So PCOD does not mean just being overweight or obese. Even someone who could be on the leaner side also could have the features of irregular periods, could have acne, could have hirsutism, and could be branded themselves as PCOD.
Okay. So we've heard doctors saying this about thyroid, but we didn't know about PCOD also. So lean PCOD again. Okay, a lot of things like this. Yes, we women face. Doctor, some telltale signs of PCOD that we should be alert of.
So you need to reach out to a clinician if at all there is an irregular period, acne, which is persistent irrespective of the usual treatments, acne which goes beyond your teenage years, accumulation of fat in areas which is not required, unwanted hair, excessive hair thinning on the scalp, widening of the partition line, as well as velvety patches on your back, on your neck, and inner thighs.
Okay.
These are the signs and symptoms which draws attention both to the parent as well as to the individual, reaching out to the clinician for further evaluation.
Doctor, let's say if I have irregular periods, is that the result of PCOD?
Irregular periods by itself, Hemlata, may not be just the reason may not be just PCOD. There are multifactorial reasons for irregular periods. A late night, too many late nights,
Okay.
recreational drugs, sedentary lifestyle, no exercise, sitting on the chair towards your laptop for prolonged periods of time. So there's no way of activity to break down the fat. That itself can cause a hormonal change and can lead to an irregular period.
Okay.
Similarly, if you have a thyroid abnormality, an underactive thyroid or an overactive thyroid itself can also walk you towards irregular periods.
Okay.
Lactational period. A breastfeeding mother, she could have an irregularity of periods itself.
Oh.
Similarly, if there is something like a perimenopause or a premature ovarian failure itself, they can cause hormonal changes and lead to irregular periods.
Mm-hmm.
Certain medical disorders like type 2 diabetes, as well as being on the overweight side, can also walk you towards irregular periods. Certain medications like antacids, prolonged usage of antipsychotic drugs can also cause an irregularity in menstrual cycle. So PCOD just may not be the reason for irregular periods.
Okay. So we women, we end up saying, oh, it should be because of PCOD, PCOS, or thyroid issues.
Maybe the overall hype about PCOD.
Yeah, that should be there. Well, we spoke a lot about PCOD and how has it occurred, everything, and how it can be diagnosed, doctor.
Ultrasound facilities, having a suspicion about it. Clinically, we diagnose PCOD with a medical criteria called as Rotterdam's criteria, which should have at least 2 or 3 requirements. That is an irregular menstrual cycle, an ultrasound documented report of an altered stromal volume of the ovaries with multiple small follicles which are arranged in the periphery of the ovary like a pearl necklace. That's the standard synonym we use for a PCOD. As well as documented evidence in terms of lab report values of the hormonal changes. So this is how a clinician detects or diagnoses a polycystic ovarian disease.
Okay.
To a common person, if someone was to have an irregular period, someone was unable to lose down that extra kilos they have added, and someone was to have mood swings irrespective of making an effort to calm themselves down with stress elimination methods, then that is a suspicion to reach out to a gynecologist to get yourself evaluated for PCOD.
Doctor, so many women out there are going through a lot of mental issues. So will this PCOD have impact on mental health?
Rightly said, mental health definitely gets affected because of PCOD. With the hormonal changes which occur because of the polycystic ovarian disease, we have the hypothalamo-pituitary axis getting affected. So indirectly, serotonin, which is otherwise known as the happy hormone, starts fluctuating and dopamine levels change, which increases your stress factor,
Oh.
which causes mood swings. These changes could make you feel low esteem, could make you feel sad, could make you feel depressed. Again, your own self-esteem and body confidence gets affected when you see the deposits of fat in various places where you really don't want them.
Okay.
Acne. You do anything and you have the pimples popping up. You don't find them moving out. You're on a date night, you're on a party, and they are just popping out everywhere.
True.
So the self-esteem is definitely affected. So there is a major impact on mental health, leading to sadness, leading to becoming a social introvert, leading to staying in closed doors, and there's more amount of being drawn into a shell like a crab because of this.
Okay, this was very informative. Thank you. Doctor, most of the women have one major question, that is, if you have PCOD, will she be able to get pregnant or is it difficult?
PCOD and pregnancy, they're both P's together.
Oh.
But definitely, you can conceive, but the path may be slightly difficult. The journey may need some amount of medical support. Ovulation definitely is affected with irregular menstrual cycles, hormonal imbalances. So, for the ova to meet the sperm, to have a conception which is as easy as possible takes a longer time. So, conceiving may become difficult. In the journey where they feel everyone gets it easily and why me getting it a little later, why me reaching out for certain assisted reproductive services to get pregnant, that itself makes them affect their mental health. Indirectly, both together, the the journey becomes more prolonged. But it does not mean to say someone who has PCOD cannot get pregnant.
Doctor, most of the doctors have said that PCOD will be cured stage by stage, something like that, and all we have heard. But I just wanted to ask you, will PCOD be completely cured, or is it stage by stage?
Very often, I tell my patients what they want to hear. Everybody wants to hear, can PCOD be cured? Definitely, medically, there's no sunset over a PCOD. But PCOD is not a life sentence for the symptoms there. You can suppress it. You can keep it under control. And how do we do that? By keeping your stress factors low, by exercising regularly, by recognizing this early irregular symptoms of your menstrual cycle, reaching out to a clinician and getting yourself medically treated right in the beginning. You may not be able to cure the disease, but you can definitely keep it under the hammer.
Doctor, if a woman is going through a PCOD or a PCOS, regular exercise, as you say, it is must, yeah, I know. But which are all the specific food that she has to take or she has to avoid?
We'll take this question in two parts. One is the exercise part and one is the foods part.
Yes.
So coming to the exercise, any day, regular exercises in a sustained, persistent manner will keep us healthy. And coming to PCOD, moderate exercises daily in terms of jogging, walking, swimming, dancing, aerobics can definitely increase insulin sensitivity levels. In such conditions, that can help you to break down the fat. Intensive training under guidance, either from your trainer or from your cardiologist for permissible exercises also could help you go a long way. In addition, normal pilates, yoga can also add on to reduce these hormonal changes in your body.
Okay.
Coming to the foods which could be refined carbs, low glycemic index foods could definitely keep things at bay. So binge eating, regular eating, timely taking your meals can reduce your cravings, can reduce your sugary desires. That itself can again help in the proper balance of hormones of insulin and glucose in the body. Concentrating on foods like green tea. They have a lot of antioxidants in them. Cinnamon by itself. That will help us in affecting the hormonal changes in our body.
Okay.
That can keep, again, PCOD under control. So basically, following a persistent, rhythmic, proper, disciplined manner, both in terms of food, diet, as well as your exercise. Multifactorially, you can control this disease.
Okay. Doctor, we women, we feel so embarrassed to talk about PCOD and PCOS. What are some of the myths that should be known about PCOD?
I think now we're crossing over those borders, the taboos of not voicing our opinion on PCOD.
Okay.
Very often, even the mothers, grandmothers come back saying, I had irregular periods, so is my grandchild going to have it? So they are being more vocal about it, I would say. But at the same time, the biggest myth is, my mother had irregular periods. She may not have been evaluated.
Okay.
So she could have had PCOD. Will I also get PCOD? Is my gain in weight related to this PCOD only? They may not look at the fact that they're not being active. They are sitting on their laptops. They are sitting on their phones. Screen time is increasing. They have an easy scapegoat to put it on PCOD. At the same point of time, it's like, will I get pregnant? Do I need to get my daughter married early? Do I need to start freezing my eggs? This is a very common question asked, keeping PCOD in mind. Definitely not.
Okay.
PCOD does not mean you are not going to get pregnant. As I really said, conceiving may be a little difficult, but definitely not that it is not going to happen. You're more vulnerable, more susceptible, may need more treatment in terms of some amount of medical assistance to correct the hormonal changes, to identify the ovulation time and to proceed forward. Beyond that, pregnancy not happening in PCOD is a definite no for me.
Doctor, we have that misconception that PCOD is scary. If you have PCOD, then you have some disease. Something like this we keep hearing every day. And with the family also, most of the women are not open enough to talk about it. And can you please tell us how should be the family support or a partner support when you have PCOD?
Family support, I would say, should start very early.
Okay.
Do not write off the symptom of an irregular menstrual cycle. If the little one was to say, Mama, my cycle is prolonged. Mama, my cycle is scanty. Yes, you need to reassure her. Wait for the correct time. Do not reach out to the clinician very early. Do not reach out very late too. But get your little one evaluated for these symptoms. If you find those acne outbursts, instead of just brushing them off saying it's common, could be the dandruff, could be that you've not washed your face properly, maybe you're not hydrating yourself well enough. It needs some amount of support from the parent to sit across the table and give them the reassurance that this can be corrected. All you need is to take those baby steps, hydrate yourself well enough, wash your face regularly, reduce your screen time, keep the phones closed, sleep well, take good naps in between, exercise regularly. Coming to your spouse, very often, if it is a cycle which is slightly more, it's like just brushed off. My mom went through it.
Yeah.
Your mother-in-law must be going through it. Just ask your mom, pick up the phone. Definitely no. Giving her some amount of reassurance will reduce her stress. The moment her stress is reduced, her serotonin is going to build up. Her serotonin builds up, she's going to feel more bubbly, she's going to feel more energetic, and she would be able to think straight. Those low mood swings is not going to be there. She's not going to hide behind the curtains, and she will reach out to her gynecologist in time.
Thank you so much, Doctor, for breaking this down in such simple and clear terms. I'm sure most of our viewers would have now felt less confused and more hopeful after this conversation. Thank you so much.
Thank you so much, Hemlata, for having me.
We'll be right back with another episode. Till then, you all take very good care of your health. Remember, your health comes first.